Okay, so this is our cysto set that we have here. It comes with the light cord in the set. The only thing you have to pull separate is the camera, and this is our tubing that we're gonna use. In our cysto set, we have the stopcock that is gonna connect to your cysto tubing. You just wanna put a little bit of lube on the tip of it and insert it. If you don't have lube, it's kinda hard to get the stopcock into the tubing. When you connect that, just make sure you turn the notch, make sure it's off. The actual lens is gonna connect to this adapter here. You will hear it click in. This will go into the sheath, and you will turn the notch and lock it. You wanna make sure that both of your ports are closed shut, just so no water is coming out of it. This back piece, you want to make sure you put an adapter on it. There is 2 adapters or 3 adapters that come in the set. They're usually the green adapters or the gray adapter. Most common used is the green adapter. This is going to give you the port where you can put a wire up in your stent. Once this piece is put together, this is standard cysto sheath. If the patient has a stent up, the first thing they will use is the grasper. There is a grasper in the cysto set. It has little ridges on it that makes it a grasper. We also have 2 hemostats in here and a pair of scissors. You will need these to hold the wire when they put the wire up, and you will need your scissors to make sure you cut the strings off of your stents if needed. We also have a flexible biopsy forceps. The flexible biopsy forceps does not have teeth on it. These are pill packed separately. It has no teeth, like I said, and it takes the piece of whatever they want to pull out of the bladder. This will be inserted through the port with the green nipple. We also have, this is called the actual flexible biopsy. We also have a rigid biopsy. The rigid biopsy is a little different. This rigid biopsy has it to where you could just put the camera straight through the actual biopsy. So you will detach the camera and it fits right into, you hear it click. You would have to take this adapter piece off of it. This will come off, and the rigid biopsy will fit through your cysto sheath, so you can use it that way. So when you do a biopsy, whether you do a flexible biopsy or a rigid biopsy, once you take your biopsy off of your bladder, it will bleed. The cauterization that we use for that is called a Bugbee. The Bugbee, we have 2 types here. We have the regular 8 French, and it comes with a cord that's gonna connect to your Bovie machine. This Bugbee has a tip at the end that will be inserted through your channel, your working port. So the Bugbee will just feed through the sheath, and it will burn the area where they took the biopsy from. You will throw this end of the cord off to your nurse, and this end will plug right in. You will also need the foot pedal for the doctor so they can have the power to burn the biopsy site. So this is a 7 French. This is an 8 French. These are the most commonly used for a bladder biopsy. This is our semi-rigid ureteroscope. It has 2 channels also. One channel is for the water. The water is gonna go at the top port only because if they're gonna put a wire or any kind of grasper through it, you want it to be straight on. So we do have different nipples for this ureteroscope. We have the green ones that are in the set. The green ones, you just want to use them for the cysto mainly. When you use the ureteroscope, you have to have pressured water. When you have pressure, the water is going to be shooting back. So you want to use something that's going to screw on to the back, that's more secure, so water is not splashing all over the surgeon. We have different types of nipples that you can choose from depending on doctor's preference. We do have a gateway that is a double port. We have this portal seal, and I think doctor does already. That's his most common use. The one that's we use almost all the time looks just like your regular green seal, but it has the adapter white piece that's going to screw on to the back, and that's what helps it not get pushed off. When you use the semi-rigid, you can put a wire through. You could put your laser through here. If you have a stone that's in the ureter and they want to go up with just the semi-rigid, they will go up with the rigid scope. You will put the laser through, and you can also fit the basket through this port. When it gets up to the kidneys, that's when you're going to use the flexible ureter scope. Okay, so anytime you do a cysto case, whatever room you're in, you want to make sure you have the cysto cart right outside your room. Your cysto cart is going to have all of your disposable items that you will need. You will have your wires here. We have a straight wire. We have an angled wire. We also have zip wires. Your zip wires, you need to make sure they are wet before you hand them to the patient. It just makes sure that they're slippery. It's easier to go through. You have your baskets down here. You also have your lasers. They come in 200, 365, depending on how big they want to go. You're going to have your lasers down here. These are going to be all of your stents, all of your connections that are going to go to your ureter scopes, because they are pressurized. You want to make sure you have a screw-on nipple. This is where they're going to be. They have them here. They have them here. They also like to use the SAPs. Some doctors like to use the SAPs, which gives the tech control of the water flow. You still have to have it on pressure when you use the SAPs, but the tech controls the pressure that they get. Here you're going to have your sheaths for your ureter scopes, your flexible ureter scopes. They come in different sizes, different lengths, so you want to make sure that you ask the doctor what size do you think that they're going to need, and you could just grab a couple of items and have them in the room so your nurse isn't running in and out. We also have the balloon dilators up here. Okay, and if you need anything that's reprocessed, you want to go to the core, and I will show you where our core is. So this is going to be our core area. All of our sutures are here. Anything you need, Raytex slaps, anything is going to be on this wall. Our cysto area where we keep our sterile supplies is going to be here. It's labeled cysto, and this is everything that we have that is reused, reprocessed is here. If you want to come around this way. Everything is labeled. We have our cysto packs that we use for all of our cysto cases. Our rigid ureter scopes, our flexible ureter scopes. We have two different types of flexible ureter scopes. You have the digital and the non-digital. The non-digital, you have to use the camera, connects to the ureter scope. Most doctors like to use the digital flexible ureter scope, so you always want to try to pull that one. You also have your regular cystoscopes here. It says we have 5 of them. It'll tell you how many we have of this set also. If you're doing a cysto, it comes with a 30-degree lens. Sometimes they want a 70-degree lens to get all the way, a good look in the bladder. So you can come, we have the 70 or 0 degree pulled separately. Here we have a digital flexible cystoscope. It's the same thing as a ureter scope, but shorter. It's going to be just your regular scope to get into the bladder. You also have those in digital and the non-digital, just regular. All of our pill pack stuff is here. Our bug bees are going to be located here. They are labeled now. The ones for the cysto are bug bee for the ureteroscope. Again, the ureteroscope bug bees are going to be longer and smaller in diameter. Your regular bug bee for a cystoscope is going to be a regular 8 or 7 French, and it does have the cords with them. Our cysto cameras are going to be here. If you're doing a TURP or a bladder biopsy, or like any kind of resection in the bladder, a lot of times you want to pull an ELIC. An ELIC it's a bulb that connects to the cystoscope that will help you flush out the pieces out of the bladder. Here we have our DVIU sets, we have our TURP sets, and we have multiple of those. Anything you need to resect, if you're doing a button or a loop, it's going to be here. Our pill pack sheaths, if you have a patient who needs a smaller sheath other than the regular 22 sheath that comes in our cysto set, they will be pill packed here. They are labeled. Here's another 22. And I think the smallest one that we have is a 17 sheath. Here you have your urethral sounds. Depending on if you have a male patient or a female patient, you want to make sure you pull the right sounds. These are going to be male sounds. They're going to be called Van Buren's. You also have McCrae sounds. I don't think I have any. These are going to be the female sounds. You do have a flexible grasper in your cysto set, but if for any reason you drop it, you need an extra one. Here are your flexible graspers. They are labeled flexible graspers. I have plenty of those. If for any reason you're putting a catheter in and they need a wire, this is where you will find them. They are labeled here under wired guides. And what it is the catheter attaches to this wire and it helps guide them in to place the catheter correctly. Anything that you need that's reprocessed, it's going to be here. Anything that is a pill pack or something that is disposable, it's going to be on the cysto cart. So again, just make sure you have your cysto cart right outside your room.